There's something happening inside your body right now, quietly, slowly, with zero warning signs, and if you're over 60, there's a real chance it's already started. The medication you took this morning, the one sitting on your nightstand, the one you've taken for years, may not be working the same way it used to, not because the pill changed, because your body did, your arteries, your heart, your entire ability to process that medication. All of it has shifted, and nothing feels different. No pain, no alarm, no signal telling you something has changed, just a quiet internal shift, one that, in some cases, slowly narrows the gap between protected and at serious risk. Today, we're covering 5 specific medications that, after the age of 60, have been linked to increased heart risk, especially when taken without reassessment. And one of them is taken every single morning by tens of millions of people over 60, trusted, common, almost never questioned. We'll get there. But first, let me be clear about something. This is not about scaring you. This is not a reason to throw away your medications. What this is information, the kind most people never get. My name is Dr. Wilbert. I've spent 18 years in medicine, and on this channel, my goal is simple: to give you the honest, clear information about your health that you genuinely deserve to have. No complicated jargon, no unnecessary alarm, just straight answers about what's actually happening inside your body and what you can do about it. Stay with me through this one, because one of the 5 medications we're about to cover is something most people over 60 take every single day. They've taken it for years, they trust it completely, and almost no one has ever told them what it may quietly be doing to their heart. Before we get into the list, you need to understand something that most doctors never have time to fully explain, something foundational. Your body no longer processes medications the same way it did 10 years ago, and I don't mean that loosely. I mean it in a very specific, very real way. Start with your liver. Your liver breaks down most medications you take, but after 60, it works more slowly, less efficiently. A drug that used to clear your system in 8 hours might now take 12 or 14. What does that mean? A normal dose can start behaving like a higher dose, simply because your body is holding on to it longer than it should. Then there are your kidneys. They filter waste from your blood, including medication byproducts. After 60, that filtering capacity naturally declines. Substances that should be flushed out begin to linger. And then there's the layer that changes everything else, your blood vessels. After 60, the walls of your arteries have become stiffer, less flexible. The inner lining, the part that controls how blood flows and how your vessels respond to pressure, has become more sensitive and more reactive. And the balance between clotting and bleeding has become more delicate than most people ever realize. So picture this: a body that holds medication longer than it should, vessels that are more sensitive to pressure, a heart that's already working a little harder just to keep up, and into that body you place a medication that was prescribed years ago at a dose written for a different version of you and never once revisited. That's not a flaw in the medication, that's a gap in the conversation. Today, we're closing that gap. Let's start with something you almost certainly have in your home right now. Maybe in the medicine cabinet, maybe in your bag, maybe on the kitchen counter next to the coffee maker. NSAIDs, non-steroidal anti-inflammatory drugs. That's ibuprofen, the one sold as Advil or Motrin. Naproxen, sold as Aleve. And prescription-strength anti-inflammatories that work through the same mechanism. For millions of people over 60, these are the go-to solution for joint pain, back pain, and arthritis. You take one, the pain eases, and you get on with your day. Simple, reliable. But here's what's happening inside your body that you don't feel. NSAIDs work by blocking certain enzymes that trigger inflammation. That's how they reduce pain. But those same enzymes also play a protective role. They help maintain the lining of your blood vessels and keep blood flowing properly through your arteries. After 60, your arteries are already stiffer and more sensitive. So when NSAIDs interfere with that protective system, your blood vessels begin to tighten, subtly, gradually, and your blood pressure starts to climb. Not dramatically, not in a way you'd notice in real time, just quietly, persistently. At the same time, NSAIDs affect how your kidneys manage fluid. They cause your body to hold on to more sodium and water than it should, and that extra fluid increases the load on your heart. So now you have 2 things happening simultaneously: blood pressure rising, fluid load on the heart increasing. For a cardiovascular system that's already working harder after 60, that combination is not a small thing. Multiple large-scale studies have linked long-term NSAID use in older adults to meaningfully higher risk of heart attack and stroke, particularly in people who already have cardiovascular risk factors like high blood pressure or diabetes. And here's the part that makes this so easy to miss. The relief is immediate. You feel better within the hour, but the cardiovascular impact builds slowly, day by day, quietly in the background. You don't feel your blood pressure creeping up, but over months and years, it accumulates. NSAIDs aren't dangerous for everyone. Short-term, occasional, carefully monitored use may still be completely appropriate. The risk rises specifically with daily, long-term use after 60 without anyone stopping to ask whether that still makes sense for your body today. That's the conversation worth having. The second medication is even more surprising, because on the surface, it has absolutely nothing to do with your heart. It's a stomach medication. Proton pump inhibitors, PPIs. That's omeprazole, sold as Prilosec, esomeprazole, sold as Nexium. Among the most commonly prescribed medications in the world taken daily by millions of people over 60. They reduce stomach acid, they relieve heartburn and reflux, they protect the stomach lining, they seem completely harmless. And that's exactly what makes this one so easy to overlook for so long. Here's what most people don't know. Your stomach acid isn't just there to cause discomfort. It plays a critical role in absorbing key nutrients from the food you eat, specifically magnesium, calcium, and vitamin B12. And long-term PPI use gradually reduces your body's ability to absorb all three. Now let me connect that directly to your heart, because this is the part that almost never gets explained. Magnesium plays a direct role in keeping your heart rhythm stable. When magnesium levels drop, the risk of irregular heartbeats increases, including a condition called atrial fibrillation, which significantly raises stroke risk. Calcium affects how the walls of your blood vessels contract and relax, and vitamin B12 is essential for maintaining the inner lining of your blood vessels, the layer responsible for keeping blood flowing smoothly. When all three of these nutrients are being quietly depleted over months and years, the cardiovascular system becomes more vulnerable. Not in a way you feel day to day, it builds in the background. Here's the pattern I see most often. Someone starts a PPI for a short-term issue, acid reflux during a stressful period, or to protect the stomach while taking another medication. And then they're still on it 5 years later. Because nobody said to stop, because it feels safe, because nothing seems wrong. PPIs are valuable medications. For the right situation, they serve a real purpose. The issue isn't the drug itself, it's duration without reassessment. Years of use without anyone stopping to ask whether it's still needed at the same dose or at all. That's the gap. The third medication is one that millions of people over 60 rely on, not for pain, not for the stomach, but for sleep or anxiety. Benzodiazepines, that's diazepam, sold as Valium. Lorazepam, sold as Ativan. Alprazolam, sold as Xanax. Medications prescribed to calm the nervous system, reduce anxiety, and help with sleep. And they work. For many people, especially later in life when anxiety and sleeplessness become more common, these medications provide genuine relief. But here's what's happening underneath, specifically in a body that's over 60. After 60, your body becomes significantly more sensitive to benzodiazepines. They stay in your system longer, they accumulate more easily, and their sedating effect gets stronger, even at the exact same dose you've always taken. Now watch what that sets in motion. Increased sedation leads to less movement, less time on your feet, and your cardiovascular system depends on movement more than most people realize. When physical activity drops, blood flow slows. When blood flow slows, the risk of clot formation quietly increases. That's the first layer. The second layer involves breathing. Benzodiazepines can suppress the depth of breathing during sleep. They can worsen existing sleep apnea or contribute to shallow overnight breathing patterns. And when that happens, oxygen levels dip repeatedly throughout the night. Every time your oxygen drops, even slightly, your heart has to compensate. It works harder, it gets stressed. Night after night, month after month. And here's what makes this so easy to miss. It doesn't feel like a heart problem, it feels like fatigue, heavy mornings, poor sleep. You attribute it to age, to stress, to life, but the medication may be contributing quietly, cumulatively, in ways nobody has ever flagged for you. Benzodiazepines have real and valid uses. For many people, the benefit is genuine and necessary, but long-term use in a body that has changed without any review of the dose or the duration, that's where the risk begins to build in ways that deserve attention. The fourth medication on this list is completely different from everything we've covered so far. You don't need a prescription to get it. You can walk into any pharmacy, any grocery store, and buy it right off the shelf. No doctor visit, no consultation required. We're talking about decongestants. Medications people reach for when they're congested, products containing pseudoephedrine like Sudafed or phenylephrine found in dozens of common cold and sinus combination products. Your sinuses are blocked. You take one. Within an hour, you can breathe again. Simple, familiar, completely assumed to be safe, but here's the mechanism most people never think about. Decongestants work by constricting blood vessels. That's how they reduce the swelling in your nasal passages. They squeeze the vessels tighter, opening up the airways. But that constriction doesn't stay in your nose. It affects blood vessels throughout your entire body, including the ones connected directly to your heart. When blood vessels constrict body-wide, blood pressure rises. Heart rate increases. Your heart has to push harder through a system that has suddenly tightened. In a younger body with elastic, flexible arteries, this effect is usually manageable. But after 60, when your arteries are already less elastic and your cardiovascular system is already managing more than it used to, that added constriction is not a small thing. And here's where it becomes genuinely dangerous. Most people over 60 are not taking just one medication. They're already on a blood pressure pill, maybe a pain reliever, maybe something for sleep. And then cold season arrives and a decongestant gets added on top of all of that. Individually, each one may seem manageable. Together, they interact, they amplify each other. And the cardiovascular system is trying to compensate for all of them at once. When something happens, when a cardiovascular event occurs, it feels sudden. It feels like it came out of nowhere. But the buildup had been there for weeks, sometimes months, layer by layer, quietly stacking. Decongestants aren't dangerous for everyone, but for someone over 60 with cardiovascular risk factors or someone already on multiple medications, they deserve far more caution than a shelf label ever suggests. And now we come to the one I mentioned at the very beginning, the one that's going to surprise you the most. Not because it's rare, not because it's obscure, but because it's one of the most recognized, most trusted, most widely recommended medications in the world. It's been in medicine cabinets for decades. Doctors recommended it, cardiologists endorsed it, family members passed the habit down to each other. Millions of people over 60 take it every single morning without a second thought, and the science around it has quietly changed. Most people taking it right now were never told. Low-dose aspirin, 81 milligrams, one small tablet every morning. For many people over 60, this has been a daily habit for years, sometimes decades. It felt protective, it felt responsible, and for a long time, that's exactly what doctors said. Starting in the 1980s and running through much of the 2000s, low-dose aspirin was widely recommended as a preventive measure for heart attacks and strokes. The idea was straightforward. Aspirin reduces the ability of platelets to clump together and form clots, lowering the risk of a blockage in the heart or brain. Millions of people started taking it on their doctor's advice, and then they simply never stopped. But here's what most of those people were never told. The guidelines changed. Major cardiovascular organizations have updated their recommendations. For adults over 60 who have not already had a heart attack or stroke, routine daily aspirin is no longer advised. And in some cases, continuing it may actually be doing more harm than good. Here's why. Aspirin thins the blood's clotting ability. That helps prevent one type of problem. But clotting isn't only a danger, it's also how your body protects itself from bleeding. When a blood vessel is damaged, clotting is what stops the bleed. It's a protective mechanism. After 60, blood vessels become more fragile. The lining of the digestive tract becomes more sensitive. And the balance between clotting protection and bleeding risk shifts in a direction most people don't expect. So when aspirin reduces clotting ability in this context, it can increase the risk of internal bleeding in the stomach, in the intestines, and in some cases, inside the brain itself. And this is where the nuance becomes critical. There are two types of stroke. One is caused by a clot blocking blood flow to the brain. The other is caused by bleeding inside the brain. Aspirin can reduce the risk of the first type, but it can increase the risk of the second. And after 60, for someone without a prior cardiovascular event, that balance can tip in the wrong direction. Now here's the part that troubles me most. Millions of people started taking aspirin when it was standard advice 15, 20 years ago. Nobody called them, nobody sent a letter, nobody updated them at their annual checkup, so they kept taking it every morning because it felt like the responsible thing to do. But medicine moved on and the message never reached them. To be clear, aspirin is not a bad medication. For someone who has already had a heart attack or stroke, or who has specific high-risk cardiovascular conditions, it can still play an important and protective role. That hasn't changed. But for many people over 60, taking it purely out of habit, without a clear clinical reason, it deserves a fresh conversation with your doctor. Soon. 5 medications, 5 quiet mechanisms. But understanding the risk is only one side of this. The more important question is, what do you actually do now? Step 1. Schedule a proactive medication review. Not when something goes wrong. Before anything goes wrong. At your next appointment, ask your doctor or pharmacist one specific question. Write this down if you need to. Ask them, is everything I'm currently taking still appropriate for me at my age with my current health profile? That single question opens a door most people never think to open. Step 2. Pay attention to combinations. The risk from any one medication on this list may be manageable on its own. The risk from 2, 3, or 4 of them interacting inside an aging body, that's where things compound. And this includes over-the-counter products, the cold tablet, the antacid, the nighttime pain reliever. Mention everything to your doctor because everything counts. Step 3. Learn to notice the subtle signals, not dramatic ones, small, persistent ones. Fatigue that doesn't lift with rest. Shortness of breath during activities that used to feel easy. Dizziness when you stand up. Changes in your blood pressure readings at home. These aren't just aging, they are your body communicating, and they are worth a conversation. Step 4. Understand that adjustment is not failure. What worked at 55 may need recalibration at 68. That is not alarming. That is not a sign something is terribly wrong. That is biology. The goal was never to stay on the same medications forever. The goal is alignment between what you're taking and the body you actually have today. Here's something that doesn't get said nearly enough in medicine. Not everything needs to be added. In a system largely built around treating problems, prescribing something, adding something, fixing something, there is a principle that rarely gets communicated to patients. Sometimes the most important clinical decision is to step back, to evaluate what's already there, to ask whether something that made sense 3 years ago still makes sense today. There's actually a word for this in medicine. It's called deprescribing. And it is just as valid, just as important, and just as medically sound as starting a new treatment. It simply means reviewing what's there and making sure it still serves you. Every single medication we covered today has real value. NSAIDs, effective for pain, but capable of raising blood pressure and straining the heart when used long-term after 60. PP is protective for the stomach, but capable of quietly depleting the nutrients your heart depends on when used indefinitely without review. Benzodiazepines, genuine relief for anxiety and sleep, but able to slow circulation, suppress breathing, and compound cardiovascular stress in an aging body. Decongestants, fast and effective for congestion, but vessel constricting throughout the entire body and particularly risky when layered on top of other medications. And aspirin, genuinely protective in the right context, but potentially increasing bleeding risk for many people over 60 who are taking it out of habit rather than clear clinical need. Every one of these has a threshold, a point where the balance between benefit and risk begins to shift. And here's what I want you to understand about that threshold. It is not fixed. It moves with age, It moves with the other medications you're taking. It moves with your kidney function, your cardiovascular history, your lifestyle. It is not the same at 70 as it was at 55. That's not a reason for fear. That's a reason for awareness. Most people over 60 aren't on autopilot because they're careless. They're on autopilot because nobody explained that the context had shifted. Nobody told them that the body they're medicating today is not the same body those prescriptions were written for. Nobody made the call. Nobody sent the update. So here's what I want you to do before your next medical appointment. Write down every single thing you take, every prescription, every over-the-counter product, every vitamin and supplement, everything. Bring that list and ask one question. Is everything on this list still working in my favor at my age, with my health history, with everything else I'm taking? That one question can change the trajectory of your health in ways that no single medication ever could. You may not be able to control every risk factor, but you do control awareness. You control the questions you ask. You control whether your current routine still matches your current body. That's not a small thing. That is everything. Not fear, not avoidance, alignment. And alignment is what protects you. If this gave you clarity today, or made you look at your daily routine even slightly differently, consider sharing it with someone you care about. A spouse, a sibling, a close friend, a parent. Because this is exactly the kind of information that rarely finds the people who need it most. And sometimes, one conversation at the right moment is all it takes to catch something before it becomes a crisis. Take care of yourself. I'll see you in the next one.